My name is Sarah Weinsztok. I am a postdoctoral researcher at the University of Kansas at the Lawrence campus. And I'm really excited to have the opportunity to talk to you all today about my TL1 funded postdoctoral research project, where we are in the stages of that project and how Frontiers has really helped me to accomplish some of these goals. And because the theme of today's symposium is mentorship, I do want to shout out my mentors, Dr. Michael Amlung and Dr. Laura Martin, for just being fantastic, very collegial, and just absolutely wonderful mentors. So the title of my funded project is a prospective behavioral economic analysis of alternative sources of reinforcement for hazardous alcohol use. I'm going to give just a brief background because I don't have very much time. I could talk about this for hours, but behavioral economics posits that alcohol use and drug use is a molar choice pattern, so a temporally extended choice pattern that's influenced by contextual factors. This means that alternative commodities or activities can therefore influence alcohol demand in a variety of ways. And I want to kind of demonstrate two of the major ways in which we can see those interactions in the graphs here below. So on the left-hand side, we're not looking at alcohol here, we're looking at cigarettes and cigarette puffs. But this is a demand curve. Both of these are examples of demand curves where consumption is on the y-axis and price is on the x-axis. So in a typical demand curve, as price increases, consumption decreases. As something gets more expensive, you're consuming less of it. So one way in which commodities can interact is through a complementary relationship. When cigarette puffs are available alone, you see the demand curve occurring kind of as thus, along that yellow arrow. But when cigarette puffs are concurrently available with a fixed cost alternative, here ethanol, you actually see that the ethanol functions to increase demand of the cigarette puffs, and you see kind of a similar relationship in the demand curve for the cigarette puffs and the ethanol. So this would be a complementary relationship between these two commodities. On the right is an example of a substitutable relationship. So here, tobacco cigarettes are the circle data path, the circle dots, and nicotine gum is available at a fixed low cost as an alternative. And here, the availability of nicotine gum suppresses consumption of tobacco cigarettes, and when that consumption of cigarettes goes down, you see an increase in consumption of this alternative commodity, nicotine gum. So moving forward to talk more specifically about the aims of my project, when we're looking to identify alternatives for alcohol use, we want a substitutable relationship, right? We want to suppress demand for alcohol and have some alternative that an individual can consume or engage in. So what I focus on is substance-free alternative activities. Substance-free activity promotion may influence alcohol consumption among individuals with hazardous use. But little is actually really known about the conditions under which and for whom this type of intervention will be effective. So the purpose of this project is to conduct a series of studies analyzing the ways in which behavioral economic frameworks can be used to determine the impact of substance-free activities on demand for alcohol. And these are my primary aims: to explore the relationship between alternative activity engagement and economic demand indices for alcohol. Do activities function as substitutes, complements, or neither? To pinpoint the best methods to identify effective substitutable alternative activities for alcohol, and the conditions under which activity engagement contributes to long-term recovery. And then to assess the utility of novel cross-commodity purchase tasks. These are tasks in which participants are asked to choose to either consume alcohol or engage in some substance-free alternative, on predicting behavior assessed via a 28-day daily diary. And the way that we have kind of set up this series of studies is to first collect preliminary data from crowdsourcing platforms, and then to move to answer a few of our initial questions to help inform the prospective longitudinal design using a 28-day virtual daily diary. The major questions that we have for the preliminary data collection are how must behavioral economic purchase tasks, which measure commodity demand, you saw briefly in those two examples I showed earlier, be modified when using activities as variables. This has not really been done before. Usually they're directly consumable commodities like cigarette puffs and ethanol and alcohol, right? Easily discernible units of purchase. And are there certain components of alternative activities that may make them more effective in substance-free activity promotion? In the prospective longitudinal design, which I'll just touch on the end, we haven't started that component yet, we will be collecting daily assessments of alcohol demand, daily reports of alcohol and activity use and their co-use, and weekly assessments of the rewarding value of alcohol versus activities. So in this first component of this TL1 funded project, again, we're collecting preliminary data from crowdsourcing platforms, and these are some of the completed data that I'm going to be showing you today. We crowdsourced data from two major platforms, Amazon, Mechanical Turk, and Prolific. The first set of data that I want to talk to you all about comes from a study where we tested the feasibility of these cross-commodity purchase task methodology adaptations using substance-free alternative activities, which was published at the end of last year. We had a final N of 108, and we crowdsourced a sample of adults who report alcohol consumption in the past 30 days. We administered what's called an alcohol purchase task, where the cost per unit of the alcoholic beverage increases across trials, and folks are asked to hypothetically report how many beverages they would consume in a given drinking period as the cost of alcohol increases. And then we also administered an alcohol purchase task with exercise as a built-in alternative, which was made concurrently available at a lower unit price. And we did not expect to see a one-size-fits-all series of results, but we found some interesting data. And I'm going to walk through just a little bit of that today. I'm not going to get into all of it for the sake of time. These are the aggregate data on a demand curve for all 108 participants. When alcohol is available alone, you can see that you can see consumption along that black circle data path. And then when alcohol was available concurrent with exercise, you see the consumption along that gray data path. And then exercise available at a fixed price is in blue. So at the aggregate level, we're not really seeing a complementary nor a substitutable relationship. Exercise is kind of operating independently of alcohol. However, there was a subset of participants, there were 15 participants for whom we actually saw a substitution of exercise for alcohol. And we can tell based on the positive slope there of exercise consumption as the cost of alcohol increases. Remember, exercise is available at a fixed price here. So why does this matter? This highlights the importance of individual differences across all people, right? A lot of times exercise is promoted kind of as a one-size-fits-all, like healthy alternative for alcohol use. That's not going to work for everybody. It doesn't function as a substitute for everyone, right? Nor should we expect it to. So at the fully aggregate level, you would say, oh, like exercise is not a functional alternative. But for some people it was. It might work for some folks, and we need to figure out those conditions and those situations in a clinical context. So the results of this first crowdsourcing study was that we found we could successfully adapt purchase task methodology to a framework of activity engagement, and we highlight the importance of individual differences and the need to individualize alternative activities. And now I'm going to touch on a second study, which is still in progress, the data analysis, that we just got these data, so they're very recent. We have an N of 86 here. Again, these are crowdsourced data. And we had participants rank order their preference of a series of activities. And these activities were derived from activity surveys, which are used in clinical research. But again, this is a non-clinical crowdsourced sample. And what we did is we piped forward the participants' highest preferred, so what they ranked as number one, their top preferred activity from this list, their second highest preferred activity, and their lowest preferred activity into these cross-commodity purchase tasks. And this is what we found. These are the data for the highest preferred alternative. And again, that activity may differ. This isn't the same activity for everyone. We do see a significant difference between the demand curves for alcohol when it's available on its own, in the black, and when it's concurrent with the highly preferred alternative, or HP, in the blue. We also see consumption. We see a very straight line there. We don't see an increased slope of consumption for the highly preferred alternative. But if you look on the y-axis, consumption of the highly preferred alternative is rather high. We see a very similar set of results for the second highest preferred alternative, but consumption is a little bit lower for that second highest preferred activity. And with the lowest preferred activity, we see very low levels of consumption, and consumption is kind of all over the place. That data path is not very pretty. So what is important to take away from this? Again, these data are still being analyzed. This is very preliminary data. But when you look at the consumption value on the y-axis, engagement in the activity or hypothetical consumption of the activity decreases as a function of preference for those activities. So why does that matter? This suggests that relative activity preference and enjoyment will impact alcohol demand, and therefore using things like rank order preference assessments may help determine appropriate alternatives. It's helpful, but it's not sufficient, right? We still didn't see substitutability or substitutable relationships, nor do we see complementary relationships. So preference may matter, but it is not the only component, the only thing that impacts whether a given activity would be a useful alternative or a useful substitute. So this brings me to part 2, which we haven't started yet, but hopefully within the next few weeks we'll get this started. These data kind of help to inform our prospective daily diary component, where we'll be assessing the utility of these purchase task methods on predicting and looking at behavior allocation to both alcohol and substance-free activities across 28 days, and to explore relationships between daily alternative activity engagement and daily economic demand indices for alcohol and alternatives on the likelihood of daily alcohol use. Ooh, jumped ahead. So this IRB is submitted, it's awaiting review. Hopefully we'll get that back very soon and get this started. Just to wrap up with some concluding remarks, behavioral economic frameworks have broad utility and may be capable of pinpointing conditions under which promoting substance-free activities will be a useful intervention component for alcohol use. The funding that I've received from Frontiers has really allowed me to begin to answer these questions, and I see the future of this research moving from translational arrangements to clinical interventions. And I want to wrap up by thanking my mentors, thanking Frontiers so much for the opportunity to have this funding to do this research, thank the research assistants and my collaborators without whom this work could not be done, and I really appreciate it. And if we have time for questions, I'm happy to answer any.
Thank you. We have some time for questions for Sarah. Sarah, I want to pose a question to you.
Sure.
As a lung doctor, a pulmonologist, I have to do this with my patients often, and your idea is so great. I mean, it's like you have to get them from choosing a behavior that's affecting them adversely right. to thinking about a new behavior that is healthy, but yet allows them to relieve the stress that mm-hmm. often smoking is what they say. This is how they relieve their stress.
Right.
What I've also found is that social support is such an important component of that. Like, I could give them alternatives, but if they don't have that support mechanism there, they won't do it, or even worse, sometimes their spouse or significant other gives them another cigarette, right?
Right.
So how do you incorporate that in terms of thinking of these alternative activities for your somebody that's participating in this?
Yeah, that's a fantastic question. Thank you. Something that I didn't have a chance to, just with limited time, to touch on in this talk is the importance of having a multi-component intervention. So this can absolutely be a useful component or a useful arm of an intervention. And for some folks, just leading them to the water, right, and identifying those alternative activities and maybe doing some value-based motivational interviewing to promote engagement in those activities is sufficient. But for many folks, it won't be. And so using concepts that have been kind of done before in substance use and behavioral interventions, like a therapeutic workplace, community reinforcement approaches, where you are bringing in family, you're bringing in coworkers, friends, colleagues, people to help promote continued engagement, especially at first, because for some folks with alcohol use disorder or other substance use disorder, changing that behavior initially can be really, really aversive and really, really hard. So just building up that habit and having social support to do that can be really useful too. So I definitely see the future of this work incorporating that kind of therapeutic social support as well. And I think that's a really important point. So thank you so much.
Thank you, sir. Other questions for Sarah?
Thank you so much for a really interesting talk, and congrats on all your TL1 work. I'm curious how you plan on deploying the daily diary in your study. Is it paper, pencil, electronic? And then what types of instructions are you specifically giving participants to complete that?
Fantastic question. So this will be a virtual daily diary, and we will use an EMA software, an ecological momentary assessment software, to send alerts to everyone in the morning of each day to complete this brief survey. And we have that survey programmed in Qualtrics. So it'll send them a link to this Qualtrics survey, and then they complete it, and we'll get the data automatically. We will have an initial in-person laboratory component that'll be about 2 hours, where we will bring the participants in and do the traditional kind of demographic questions and drinking-related behavior sort of questions, but we will also be walking them through how to complete the daily diary, what we're looking for. We'll have them do a practice daily diary and provide feedback on it, just to make sure that there's no confusion. And then we will have frequent touch points with participants as well, and frequent contact in case there are any questions that come up.
Thank you.
Yeah, great question. Thanks.
Well, thank you, Dr. Weinsztok.
Thank you.